Hello, welcome to part 45 of Clinical Physiotherapy MCQ series. Here we gon discuss day-to-day clinical scenario with detailed explanation. Now don't waste our time, let's move to question number 221. A patient with a purulent venous insufficiency ulcer near the left medial malleolus is seen at home by a physical therapist. The most important goal or intervention for the therapist to try to achieve with this patient is: Option A, daily changes of elastic wraps to reduce fluid buildup. Option B, daily warm water baths to improve circulation. Option C, increase ambulation endurance to hasten wound healing. Option D, instruct in proper dressing changes and wound care. And the answer is Option D, instruct in proper dressing changes and wound care. Explanation for this question is: proper dressing changes and wound care to prevent secondary wound infection are the hallmarks of conservative management of venous ulcers. Pliable, non-stretchable dressing wraps, e.g., Unna boot, or custom-fitted support stockings can be used to assist in venous circulation, while elastic wraps do little to assist circulation. Prolonged hydrotherapy is contraindicated for venous ulcers. Now let's move to question number 222. Your patient is having difficulty bearing weight on the left leg. She is unable to advance the tibia forward and abbreviates the end of the stance phase on the left, going directly into swing phase. The most likely cause of her problem is: Option A, hip extensor weakness. Option B, spasticity of the anterior tibialis muscle. Option C, spasticity or contracture of the plantarflexors. Option D, weakness or contracture of the dorsiflexors. And the answer is Option C, spasticity or contracture of the plantarflexors. Explanation for this question is: forward advancement of the tibia from midstance to heel off is controlled by eccentric contraction of the plantarflexors. From heel off to toe off, the plantarflexors contract concentrically. Either spasticity or contracture of the plantarflexors would limit this forward progression. Patients compensate by going right into swing, typically with circumducted gait, or with increased hip and knee flexion since there is no push-off. Now let's move question number 223. A patient with a middle cerebral artery vascular lesion has difficulty raising his arm. Which of the following synergy patterns is most likely present in the patient's involved upper extremity during elevation? Option A, scapular retraction, humeral abduction, elbow flexion, wrist supination. Option B, scapular retraction, humeral adduction, elbow extension, wrist supination. Option C, scapular protraction, humeral abduction, elbow flexion, wrist supination. Option D, scapular protraction, humeral adduction, elbow extension, wrist supination. And the answer is Option A, scapular retraction, humeral abduction, elbow flexion, wrist supination. Explanation for this question is: the typical flexion synergy pattern in patients after a stroke includes scapular retraction, humeral abduction, elbow flexion, wrist supination, and wrist and finger flexion. Now let's move to question number 224. A physical therapist is evaluating a patient with ulceration on the lower extremity. The leg is apparently swollen and red upon examination. The wound is irregularly shaped and feels hot to the touch. Which of the following grouping of symptoms is most consistent with this type of ulceration? Option A, ulceration is on the lateral leg, pulseless, cool, and painful. Option B, ulceration is medial leg, shows permanent blanching, and is painless. Option C, ulceration is upon bony prominences, shows non-blanchable redness at the perimeter of the wound, and has a pink appearance. Option D, ulceration is upon the bony prominence, began as a small scrape or blister several months ago, with a concomitant diagnosis of diabetic neuropathy. And the answer is Option B, ulceration is medial leg, shows permanent blanching, and is painless. Explanation for this question is: Option B explains venous insufficiency ulcers are typically less painful than arterial ulcers. While Option A, these are the most common symptoms of arterial. insufficiency ulcers. Option C, these are symptoms common to pressure ulcers. And option D, these are symptoms consistent with diabetic ulceration. Now let's move to question number 225. A patient with peripheral vascular disease comes to physical therapy for evaluation of leg pain that gets worse when walking. The patient will most likely also have option A, relief of pain with the legs elevated. Option B, purple or brown pigmentation of the skin on the legs. Option C, relief of pain with the legs in the dependent position. Option D, a positive Homan's sign, and the answer is option C, relief of pain with the legs in the dependent position. Explanation for this question is, elevating the legs in the presence of arterial insufficiency decreases blood flow, which increases pain. Purple or brown pigmentation of the skin on the legs is associated with venous insufficiency, not arterial insufficiency. The patient most likely has intermittent claudication caused by arterial insufficiency. Placing the patient's legs in the dependent position facilitates blood flow and reduces pain. Pain with exercise is indicative of intermittent claudication, not deep vein thrombosis, which is associated with a positive Homan's sign. So, that's all for today. If you have any doubts, please comment below. I think you have learned something valuable today. See you on the next part, that's part 46. See you till then, bye bye.